Tune in.
Hey, you guys, this is Paris from the Diva Hustle Show. Today, my guest is Dr. Ben Galyardt. He's the founder of the F8 Well Center and the Galyardt Methods. Hi, doctor. How are you?
Doing great. Thank you. Thanks for having me on today.
No problem. So, I wanted to have you on today to talk about the Ozempic and how people are utilizing it to as a weight loss drug when it was intended used for people with diabetes and to regulate their sugars.
Absolutely. Yeah, it's pretty fascinating. There's this whole new class of drugs out there, the Wegovy, a bunch of different ones that people are looking for. We kind of joked forever, hey, we're going to get that miracle pill, right?
Right.
Just give me that pill and I'll lose weight, and I don't have to change what I'm eating, right?
Uh-huh. So can you explain how does the Ozempic works to promote weight loss? And why
Yeah.
is it different from other weight loss medications?
Yeah. So ultimately, it was approved by the FDA as a diabetes drug, and for type 2 diabetes.
Right.
Type 2 diabetes is not like this thing that you get to, or this disease that you get. It's a state where your blood sugar is too high.
Right.
And so taking a drug, it used to be metformin. There's various drugs that have been used for years and years for this. And so now this is this latest class of drugs, whether it's an injectable or whichever way they're bringing these in. And so it basically decreases the blood sugar,
Okay.
lowers your blood sugar, which can have benefit. And they're even looking at metformin. Some people look at that as like this longevity drug that can help you live longer and live healthier and things like that. But unfortunately, there are side effects.
Mhm.
And it also, not everybody that is overweight that needs to lose weight is just high blood sugar. A lot of people, they're actually going high and low, high and low. And
Right.
so if this drug is just lowering blood sugar, it's actually going to make the lows worse. And that's going to be the hangry, the tired, spacey, just those times when you get like tunnel vision and just you're not functioning well.
Right. And like you touched on some of the side effects. What is the some major side effects that people can have just from taking this medication? Like if they're not, I mean, because I saw where people are like, oh, it cuts out hunger, they're not hungry, things like that. But what is the side effects that people are experiencing?
Yeah, absolutely. We can see digestive disturbance is pretty common, where people can have nausea, diarrhea, a lot of discomfort in the digestive tract. And then, like we were saying, it can contribute to a hypoglycemia events, and that can be where people even pass out. When that blood sugar gets low enough. If you've ever been hangry, did you ever go like, give me something now? It can go to that
Right.
plus this exaggerated response. And then the ultimate side effect of taking this is that people don't take it forever. And when they stop, the
Right.
research shows they go right back where they were or even worse. So it's basically a new type of yo-yo diet here that people are going on.
And I see videos, especially on TikTok, where people are like, oh, I've been on this for like almost a year. And I mean, I worry about the long-term effects that's not being addressed.
Absolutely. Yeah, because here's the deal. I always look at this as weight is not the cause of your problems.
Right.
Weight is the side effect of your problems. So we take at F8, we take this systems-based approach, meaning, okay, it's not like I want you to lose weight. And somebody comes into the office and we go, okay, that's your number one goal is to lose weight. And I'm like, well, you know what? You might or you might not. Odds are you will. I just had a lady last week that in the first 30 days, she's down from 291 down to 261. And that can happen. But my number one goal is to get you healthy. And that's what you have to be thinking about. Anybody that's thinking about any of these new class of diabetes drugs that they're using for weight loss, you have to still think about, why are you overweight in the first place? And here's some of the things that you really need to be thinking about. You need to be thinking about, yes, your blood sugar, but not just taking a drug to lower that blood sugar, but why? And so with every one of our patients, we give them a continuous glucose monitor, that little patch that goes on the back of the arm. And even if you can't get one of those, get a finger prick glucose monitor, and you're going to be able to see why that blood sugar goes up, why it goes down. Some people, if they eat any kind of rice, their blood sugar spikes up.
Right.
And that is going to drive this weight gain as well. Some people, it's any fruit can make them go. So it's really individualized, and that's what we've learned. So blood sugar is a crucial part of it, but learning how to stabilize that blood sugar is crucial. I'll give you this example. My oldest son, he's 18. He's getting ready to graduate next month. So good luck out in the real world. And he's literally down 30 pounds from last fall. He was 217, now he's 187, and he's worn that continuous glucose monitor. So there is a blood sugar component to it.
Right.
And that's not the trick, is not just to try to lower it and just take this drug. And so then you don't eat. And then most women I see that actually are overweight don't eat enough calories to begin with.
Wow.
You know, there might be 1,000, 1,200, 1,300, and they might need 16, 17, 1,800 calories a day. And so a lot of people are already under eating. And then we're like, hey, we're going to even cut cravings more, and then you're down into the 600, 800,000, and then you're undernourishing your body.
Right. And that was my next question, is to ask you, like, do you feel medication is needed to manage weight loss? Or is it just something like you were saying, managing your sugars? You know, you might have to increase your calorie intake and things like that.
Yeah, so here's what we've seen in practice, and this is, you know, from thousands and thousands of people that I've worked one-on-one with, is that taking a medication never is a long-term fix.
Right.
So it can accomplish certain things. Remember the HCG injections that they were doing a while back? You know, this pregnancy, like, takes a pregnancy hormone, injects it in them, and then eats 600 calories a day, and they lose 40 pounds and then stop. And every single person I know that did it, right back where they were, because they didn't learn any new skills, learn any new information that tells them what to do. You know, some of the other things that we're looking at are just actual general inflammation. So a lot of people, you're holding on to weight because you're inflamed. And that's where, if you kind of pinch your arm and if you just feel puffy,
right,
and you know, socks off and you got this ring where your socks were and you're just puffy, a lot of people are actually holding 10, 20, even 30 pounds of fluid in their body.
wow,
That's the amount of weight loss drug is going to get off of them, because they're not fixing why they're inflamed in the first place. And that's where you got to start looking into toxins. The body's solution to pollution is dilution. So we're going to hold on to fluid, all these different things. So you got to help your liver detoxify, help your gut function better. So many different things that need to be addressed before you just go, I need to lose weight.
right. And yeah, and I want a quick solution, so let me just go. And that's the other part, where people are like, I read a study where they were saying people just paying like thousands of dollars just for this drug just to lose weight. And I'm like, now, but why not just, you know, like, I know for me, I tried this, I drank this liver, I'm drinking this liver tea, and it's supposed to clean out your liver, right? And now that was like $20. I feel like it's working.
I mean, but think about this. There's a shortage on a lot of these new drugs out there that are supposed to be there for diabetics. That the research is there. It shows that it does get their blood sugar down. And if you're in a diabetic state, and you know, I look at it like this: if someone's not going to change what they're putting in their mouth, not going to change what they're eating, what they're drinking, and that's just it. Okay, well, taking this drug may be better than nothing. But if you want to truly fix it, you can. And that's what we get to see, especially if you're tracking your blood sugar. So this is way more effective than any kind of drug out there, is to actually track your blood sugar. For years, we just did finger prick glucose monitoring patients, and they'd see, oh my gosh, that spiked up really high. Potatoes or sweet potatoes are actually worse than white potatoes for certain people. And then you do more of the good stuff, less of the bad stuff. Now we actually have the continuous glucose monitor, where you can see that over and over and over. And this is good for insulin resistance, for PCOS, polycystic ovarian syndrome, if you've got autoimmune disease, you've got to learn how to stabilize that blood sugar, because every time the blood sugar spikes up, it's going to destroy more tissue. Every time you crash down, you're going to destroy more tissue. So just by lowering blood sugar doesn't get rid of the peaks and valleys. So you're looking at Hashimoto's, Crohn's disease, lupus, rheumatoid arthritis, MS, all these different autoimmune diseases. You've got to learn how to stabilize that blood sugar.
That's true. And do you feel Ozempic fits into the overall management of obesity?
You know, here we're getting into a different thought process. You know, there's overweight, and a lot of people are using this drug to lose 20 pounds or 30 pounds. When I think of somebody with obesity, I'm thinking 100 pounds, 80 pounds, 150 pounds. And usually at that point, there is a mental, emotional component to it. You know, if somebody has 150 pounds to lose, that's not usually just, you know what, I grabbed the large fries at McDonald's versus the small fries. You know, there's usually some other thing going on there. And sometimes, yes, you do need something to break that cycle.
Yes.
But again, it's not a long-term fix, and they have to still address the emotional component, the mental component. You've got to address what is actually better for your body to eat. You know, we all go, oh yeah, I know what I should be eating, but a lot of people still don't.
Right.
They don't know, should they be eating sweet potato or white potato, brown rice or white rice? Do beans do okay for them or not? A lot of these things that are supposedly healthy may not actually be healthy.
True. And you hit on the point. And even eating those certain foods at a certain time of day can spike a person's sugar, right? So like you're saying, by monitoring your sugars and what you're eating, you're able to see what's causing your sugars to spike.
Absolutely.
Do you feel like certain people should stay away from Ozempic, especially if they're not being monitored, like you're saying, with a doctor?
Yeah. And that's the scary part, is this is a drug that was designed to be monitored by their physician for people that are very high blood sugar, type 2 diabetics, and possibly, you know, now it may be into that obese state. But even in the obese state, they're going to be monitored as well. But a lot of people are getting it, I don't know where they're getting on the black market,
black market, the side street, up the street.
Yeah, they're not buying their crack anymore. They're getting their
right
drug. And so you know, it's definitely something that should be used with caution, and should be used only in that time where, okay, here's the thought process of how long we're going to go about using it, what you're going to be doing during that phase to really learn how to overcome these issues, and not just sit there and go, you know what, this drug is going to fix me, and 20 years from now I'm still going to be taking it and I won't be overweight.
Right. And then the thing is, I was telling a friend of mine, I worry about the long-term effect. I saw one lady, she had pancreatitis problems, right? Acute pancreatitis. And, you know, I worry, but that's the stuff that needs to be talked about, because if you're not being monitored by a doctor in the long-term effect of it, you know, that needs to be addressed to get people to think before they even go purchase it. Like, okay, let me think about this.
Yeah, absolutely. And there's so many side effects that even for one person, it might be okay, but for your friend, it might not be okay. You may do great. You may lose 30 pounds on it and feel great, where the next person, their body may, and here's the other thing, they may be taking 1 or 2 or 3 other medications that interact, that are already stressing out the liver, that are already causing some GI issues, whatever it is. And so, you know, there is no one size fits all. And that's the problem with this. And you've got Elon Musk, you know, going on this drug, and all these big wig celebrities out there, and you're like, oh, it must be the greatest. And I mean, it even got up to where, you know, diabetics couldn't even get these drugs, because there were so many people were using it for weight loss.
And what advice would you give people that are considering even taking Ozempic to lose weight?
Yeah. So if you're going to do this, and if you're like, you know, I am set on going in and taking this drug, and I have 3 friends that did it, and I watched that TikTok video and everybody's like, oh my gosh, this is where I need to be. Okay, so that's fine. Go down that path, get your blood work done, look at your liver enzymes, look to make sure your body is responding okay. But ultimately, you still have to move your feet and figure out why you're overweight in the first place, and look at your hormones, look at your thyroid. Are your thyroid hormones where they need to be? Do you have autoimmune diseases? What's your inflammation doing? All these different things. Are you super stressed? If cortisol's too high, the adrenal hormone, you're going to put on body fat. So all of these things need to be addressed, because so many people think that just losing weight, one, yeah, you look better in a bikini, but two, you're not fixing the why, and you can still die, you can still get autoimmune disease, you can still feel horrible even when you lose weight.
Right, that's true, and that's, I think you hit on it. If you're not going to get to the root of the problem of how you gained the weight and what's really going on, I feel like it's just a band-aid that you're putting on, and then the band-aid come off, but then the band-aid the wound can open right back up, right?
Absolutely. Yeah, I look back, when I was a kid, my mom, she did like cabbage diet, and she, all these different, it's the same thing, but now it's a medication instead of the, there was keto and there's paleo and vegan, all these different diets, but learning what your body needs is the best thing that you can do.
Right. And if people wanted to get in contact with you, doctor, what's the best way of getting in contact with you?
Yeah, absolutely. It is F8, just F and then the number F8, F8wellcenters.com. You can check me out on TikTok. We just hit 275,000 followers on there, on Instagram, as well as Facebook. And then we've got a bunch of videos on YouTube explaining in detail how to check your blood sugar, how to lose weight, how to help your thyroid issues, Hashimoto's, anything like that as well. So.
Well, thank you, doctor, for joining us, joining me, talking with me about this. I feel like this is something medically that needs to be discussed, just so, to get people wheels turning, like before they go and make that purchase, the long-term effect that can possibly come down the road. Like it's an instant fix. You might not, or you might lose weight, but just start thinking about it. You know what I mean? So I appreciate you talking with me about it.
Absolutely. Thanks for having me on.
No worries.
Tone in.